Okay, camera's rolling. Whenever you're ready, Karen.
All right, Scott, and I forgot to tell you, you can just look at me even if they ask the questions.
All right.
Start by telling us your name
My name is Scott Miller.
and tell us a little bit about what happened to you before you had your stroke, what you were doing before you had your stroke.
Before I had my stroke, I was a graphic designer. I started a firm many years ago, and I think it's been 37 years now, and it's still running. I was also a marathon runner, a rower. I played golf, and I skied. So I was very active.
And before you had your stroke, did you have any health problems that would predicted that you might have a stroke?
No, with all that stuff going on, I felt I was pretty immune. However, I found out, well, there were two factors for my stroke at least. One was that there was some family hereditary issues, and the second was that I had blood pressure that was high. I was taking a medication for it. However, when my meds ran out, I failed to get a script on time, and I had a stroke. My stroke was a aneurysm, which led to a hemorrhagic bleed, a very bad one, and I have paralysis on my left-hand side. I also have lost most of the vision of my left-hand side. Aside from that, I'm in great shape.
Where were you when you had your stroke?
I was at the office working late one afternoon, and I had the stroke. I knew what it was because I believe I had a TIA, which is a transient ischemic attack, several weeks beforehand, although I didn't really know what it was because it came and went. Then I realized a TIA is a stroke in dress rehearsal, and when I had the stroke, I knew immediately what it was. But I fell on the floor and I wasn't found for a long time, which led to a very large amount of bleeding, which accounted for my paralysis and the other problems associated with that.
Tell us about when you went to the hospital. Where were you there? How long did you stay?
I was at a acute hospital, was then taken once my symptoms had stabilized to a rehabilitative hospital where I was a patient for a little more than a half a year. I was an inpatient at the hospital for 3 months on a stroke unit. And then I was in a day program for 3.5 months after that. So a total of a little over half a year.
So take us back to when you were in the acute care hospital and you were about to be transferred that day to rehab. What was going through your mind?
Not a clue. Scared to death. It's a very big change to go from acute care to a follow-up healthcare facility. There are so many questions that patients have. Where am I going to go? What's going to happen from it? Am I ever going to get better? The question is, what's better? Since that time, and that was 9 years ago, I have found out that I don't think there's any such thing as better. It's how far you can come back from a stroke. How much can you recover? And I tell both patients and family members, there is life after stroke. Your life does not end because of stroke. It's just like anything else in life. It's what you make of it. How can you get back? People mistakenly think, am I going to get better? And then I repeat myself, what's better mean? Does it mean, I believe they think it means I want to get back to exactly the same person I was before I had the stroke, which in my mind is not possible. You can come back as a better person. You can pursue other options. You can do other things in your life. You are given a second chance at life. How cool is that?
How are you a better person because of your stroke?
I think I appreciate things more. I think I take nothing for granted.
Scott, if I could jump in on a question like that, if you could say, since I've had my stroke,
Yeah,
I don't, so then we can have that context in case we use it. sorry.
Yeah, no, I realize that I should repeat the question to some degree or work it in the answer.
Yeah.
Yeah.
Okay, we're ready.
Is there anything you want to go back on?
No, I think we're okay.
All right.
Just this one, I think would be nice to have that opening set up so people are real clear where you're going. Once you ask that
Yeah,
question.
so if getting back to exactly what you were before the stroke isn't the goal, how are you a better person, a different person now as a result of your stroke?
I'm different since a stroke. Excuse me. Sorry. I'm a different person since my stroke because I appreciate things more. I take nothing for granted. I'm very glad that I'm still alive, and I'm doing other things in my life that I did not do before, which I think are probably far more important in the larger scale of things. They have more meaning.
Tell me about some of the things that you're doing now.
Since the stroke, I've had to completely change my life. I am a volunteer at a local rehabilitation facility, which I do 5 days a week. I volunteer about 1,000 hours a year. One of the things I do at that is I'm a facilitator in a stroke support group. I've done roughly 350 of those groups. I learn something every time the stroke group comes about. I feel I have a lot of information from a practical or a realistic point of view to pass on to patients that have recently had a stroke.
What are the big messages you like to convey to people that have just had a stroke and are new in your group?
One of the things, or one of several things that I talk about in the group almost on a regular basis, because there are new members every group, is that there is more than life doesn't end when you have a stroke. Life is very different, or it can be different, but here is the possibility of patients doing other things that they hadn't done before the stroke. I encourage other types of activities. Learn a language, read more. Don't watch as much television. I feel it's very important to tell people to be encouraged, not to say, oh gosh, it's so gloomy. Last week in my group, a woman stood up and she said, I'm so depressed, my life is over. And another one said, mine too. And a third one said, yeah, and so is mine. And I said, it's not the case at all. You just have to realize you're not the same person. You may never become the same person, but you may become a better person. Find some other things to do. Help people. Get involved in helping stroke patients. I'm a big advocate of mentorship. I feel everybody has something, whether it's just helping the kid down the street with his math or getting involved with a volunteer organization in some way. Become a person that's more involved with their community and other people. And I've learned that since the stroke.
Talk about some of the things that you do to work on your physical abilities now.
One of the things that I have to do almost every day is keep working on my progress, whether it's physical therapy, whether it's mental therapy, and by that I mean whether it's reading or writing, or I'm very poor at organization because of the stroke, so I have to work at that. I can't stay the designer that I was before, a graphic designer that I was before, because part of graphic design is organization, and that was stripped of me because of the stroke. So I have to work at small exercises to help with that. I do PT sometimes 4 times a week, usually 2 times a week. And that is at a group that helps with people who have had life-altering events like myself get back to becoming physically stronger, mentally stronger, physically more flexible, more are much more able to do the kinds of things physically that they did before. I'll never get there. I've started to play golf again, which it took 5 years just for me to be able to pick up a club and swing it because my balance was so poor. And there's a big psychological thing about not being able to play the way you did before. But I'll get there, I hope. I can't get back to playing the piano because I have only the use of one arm. This one is still paralyzed. I've never learned the play piano by your elbow or elbows approach, or the Professor Longhair, where you're beating with your fingers and your palm of your hand. But who knows? I don't say never, or I never say never.
So to all those health providers that say after 6 months you can't expect much return, what do you say to them?
Conventional wisdom was that in the first 6 months after you have your stroke is the time where you will make the most progress in overcoming your deficits. I believe that that is not the case any longer. I've been 9 years and I still make progress, albeit slowly. And I tell the patients that I talk with, speed of recovery is roughly the equivalent of the speed of the movement of glaciers, which it is because you make very tiny increments of progress, which is why I also encourage people to keep a notebook and write down on one side of the page everything you can do, and on the other side of the page all the things that you can't do, and then look at it, whether it's once a day, a week. For me it was every 10 minutes. And you'll be able to see, oh, I couldn't do that before and now I can. It's motivational. It's put down things that are small goals for you to be able to attain by working at them, whether it's individually, hopefully it's with a therapist.
Take us back to your acute rehab stay. Many patients enter that essentially hopeless. Where were you on the hope spectrum when you started rehab and then where you ended up?
Give me a minute here. There's a word I'm trying to think of. All right, I got it. Doctors say, and as I just said a minute ago, doctors have been wrong and are being proven wrong every day, saying you only make your progress in 6 months. And I say, no, you can make it for years because I can see it myself. On the other side of that, strokes are like snowflakes. No two of them are exactly the same. So the typical kind of question I hear all the time is, well, I have a stroke like my roommate here at the hospital. He's getting better. Am I going to be? And again, I say, because strokes are very different, they affect everyone in a different way. When I was in the acute hospital, I was waiting for and finally got something that's called insight. And typically that can mean two different kinds of things. Insight is when you realize or begin to realize your deficits. Can I walk 500 feet? I kind of doubt it. It's just that you realize I can make 20 steps, or maybe the next day I can make 30 steps. But a large goal is probably unattainable at this time. Can I walk across my house? Yes. Can I walk down to the mailbox and get the mail? Possibly. But insight is to realize what you can and can't do. And one of the realizations of that and why you want to realize that is because safety is a big factor. Is it easy to do the things that you did before? Maybe, maybe not. But realizing I used to be able to do it, I can't do it now, but maybe I can do a portion of that, or maybe I could do something a little differently. The other thing which I felt was important in terms of insight was how you see people and how you realize who people are. Before, I used to see people from the outside in. Now I read people from the inside out. I can see what's making them tick, which to me is a great advantage. Not for any kind of thing other than to realize how is that person going to be able to understand what I say? Am I making sense to them? Do they have a feeling towards me, even though I'm disabled? Is that going to stand in the way of our relationship? Hopefully not.
Let me ask you this, let's go back 9 years to when you were in rehabilitation. You had the benefit of having a good rehab hospital close.
Yes.
And the place that we're filming for does not have that.
Right.
Tell me about the benefits about having your family close to you as you went through your acute rehab phase.
One of the main factors in coming back from a stroke is support. Support from a family, so that was important when I was at a rehab facility close to my home. Support and just, we are here, we love you. We are hoping that you will be joining us shortly. Another factor is keeping your sense of humor, big one. It's always good to keep your sense of humor because it's a silly thing. Stroke is something that you can come back from, albeit differently for different people. Another factor which seems to be a growing one, and there seems to be scientific evidence to support it, are people's sense of faith, whatever that may be, and whatever religion they happen to be a part of. But faith is a big, big factor in recovery. I also had the advantage when I was in acute care of a nurse who was pretty spectacular. She would just come to my bedside at night and sit and talk. And even though I felt I was down at the long, long end of a very long tunnel, I could hear her. And that was a big support that I'm still here in this world. I'm not dead yet.
Do other things come to mind when you think of your rehab? Other people that were really pivotal to your health at the moment? Therapists, speech pathologist, OT, PT, somebody that really, even now, all these years later, you think back on them and you go, they really helped me.
Absolutely. Sorry. Some of the other factors in my recovery were people on the acute floor that I was located. Therapists.
Let me just stop that. You said that a couple times, and just because acute is different than acute rehab, you can just say rehab if
Okay.
you want, even though what they're doing in Florida is acute rehab. That's my bad. Acute means acute hospital.
Okay.
So,
Sure.
So let me phrase it again. Tell me about some of the people, some of the professionals you worked with during your rehabilitation stay that are absolutely memorable to you even now.
I was very fortunate when I was at the hospital because I had a core group of people who helped me come back from being at the end of a long tunnel. Those included doctors, nurses, and especially therapists, whether they were physical therapists, OT, occupational therapists, speech therapists. I took therapy in equestrian events, pool aquatic therapy, horticultural therapy. If there was a therapy offered, I had it, and I took it. But I also feel the most important were therapists. And the reason I say that is because they're a very special breed of cat. They are there to support you and to encourage you and to bring you back from a very dark place. Having strokes is no easy thing. Having really good therapists to support you is everything. I mean, aside from the doctors who are doing it from a medical point of view. and the nurses who are helping as well on that level.
What are the qualities of the therapist, no matter which one you think of? What are the qualities of the therapists that you think are most important? Rolling?
Okay, we're rolling.
Would you please repeat your question?
Okay.
Thank you.
Regardless of the therapy, what are the qualities, personal qualities of the therapist that you think are most important?
Well, I have been dealing with various therapists for 9 years, and some of the qualities that I see that differentiate really good therapists from ones that are still good but don't have that kind of intensity. Understanding the needs of a stroke patient, and they're very different from somebody who comes in with a broken arm or that has some other kind of an ailment. I think therapists read into the soul of the patient. They're very good at understanding what the patient needs. They're very good at offering support and encouragement in an intelligent way. Not that they're talking down to a patient, but rather they understand what's going on there and they're able to help. If something doesn't work, a good therapist is able to turn things slightly one way or another and make them work, whether that's physical therapy or occupational therapy or a number of other therapies. I'm looking at you, but I also feel I'm looking at the light to some degree. Is that working or not?
Yeah, I don't feel distracted. It's when
Okay.
if you look up real high or look off to the side is when it seems like maybe they're looking at something else. But yeah, you seem to have a general glance toward her that works.
Okay.
So yeah, I haven't sensed that you're
Okay.
not having good eye contact or anything.
Boo.
You're doing great.
You're doing great. Yeah.
Take us back to the day you were being discharged from rehab and you were coming home. What was going through your mind?
Some of the factors when I made a transition from rehab to home were, how am I going to get up and down stairs? How can I maneuver within my own house? One of the factors that people who have had strokes have erroneously is, when I get home, everything is going to be just fine. I don't have to worry about anything. It's just the opposite. You have to be sure you have grab bars at home. You have understood that scatter rugs are really dangerous. Pets are also really dangerous. They're very happy to see you are home, but cats coming up in back of you and going meow, 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 and the tail going up the leg and stuff, and they come out of nowhere. Dogs are the same way. Oh, I'm so happy you're home. I want to jump up on you. Put them away for a couple of weeks till they get used to you being home and you get used to them being there. I just think it's home is a very different environment from what you remember it to be. Are certain hallways darker than you remember? You need more light. Don't get home and think you're going to start cooking gourmet meals again if you're a cook. Or that you can get right out and get to the gardening that's been delinquent since you've been away. It takes time. Again, the speed of the movement of the speed of glaciers.
I lost my next question. Anybody want to jump in?
Did you have when you first came home, did you have someone like teach you those things? Throw rugs and stairs or what did that look like?
When I left the rehabilitation facility that I was, there is a home audit by the therapist.
Just to talk to, I'm sorry.
Even when they ask
Yeah,
to
to talk to Ken.
Yes.
Okay.
I want to
So
hear you
pick that
answer.
up again.
Guilty pleasure, huh?
And of course, I can't hear unless you're looking at me.
That's true. You aren't there.
So who taught you to look out for things like scatter rugs and
Yeah.
all that when you were to return home?
When I returned home, I was fortunate that I had taken a falls class at the rehabilitation facility I was in, so I knew how to get up, sort of. It's a very difficult thing to do. I also had a home audit that was done by the therapist at the rehabilitation facility. So I knew I had to watch out for things like scatter rugs, lighting, depth of field, because my depth of field had been affected by the stroke. And other things I had to learn on my own. As an example, when I am in a car, and since I can't drive any longer, I'm a willing passenger. I wear sunglasses because the amount of input that comes in as you're driving is almost overwhelming. So I wear sunglasses or a cap or something to shield out all that stuff which comes by your eyes. All right, and I close my eyes. And a number of things you learn just simply because they're necessary to learn. It's a long process.
One question I had, I don't know how much Karen's explained the whole scope of what we're trying to do, but part of what they want to do there in Florida is not only institute a traditional rehab, but then take it to another level. What would you perceive, in your experience, could have been improved upon? What would make rehab better for you, or just in general? Because obviously you're very engaged with the process now. What's yet to be explored and tried? And
Boy, that's a great question, because so much of it is ruled by insurance, and what? Yes, insurance.
so just talk to Karen about that.
I know.
Yeah, that's good.
Yeah, let me have a minute to think about
Okay.
that for a second, because it's a complicated question.
So how do you think the current state of rehabilitation and getting somebody to the highest level can be improved upon?
Hard question, because so much of, start this one over. The question that was posed was, how can I, because I'm engaged with the process of rehabilitation, how can it be improved? What other steps can be made? And a lot of that is ruled or dictated by insurance and by costs and by money. I don't think enough is done for rehabilitation. I am so encouraged to see that hospitals and rehabilitation places are realizing that you don't stop improving. You need to continue the process of rehabilitation long after you leave a hospital. And are there the facilities to do that? I would certainly hope so. And I'm encouraged to hear that that is beginning to be part of the process now, that the staffs of hospitals realize when they discharge a patient, they're not just discharging them into a void, but rather there are new places and new things for them to do in order to continue their process. Whether it's a rehabilitation process, whether it's an in-home nursing or in-home service, or whether it's a SNF, which is the next step down from full-time rehabilitation. But you can't have enough rehabilitation, in my view.
Insurance will pay for some rehabilitation. What would you say to donors about bridging the gap?
Yeah. One of the things, unfortunately, that has happened and will continue is population is getting older. So there is much more of a realization that we need to do something with events like stroke, and how can we help in that area. Some of the simple things that obviously are starting to be done now are grab bars, railings, handicap access ramps. Donors who may one day face the same challenges as stroke patients do now can help with this process by creating facilities or more facilities that have to do with rehabilitation, whether it's physical therapy, occupational therapy, speech, whatever. It's encouraging also to see that there is a realization, finally, that we have a segment of our population that or has been affected by stroke will continue to have more rehabilitation, and drop that question. I'm out of a hospital now. Oh my God, what's going to happen to me now? I'm not ready to go home. I can't go back to work, although I would certainly like to. What's out there for me now? How can I get help? Where can I go?
And what are some of the answers you'd like to see?
Well, I think one of the things, and I've just mentioned it, was we need more rehabilitation facilities. We need to take that question of doubt away from patients to say, my God, what's going to happen to me now?
Wow,
Good,
powerful.
good.
Hmm.
Um,
Hmm.
I think you answered that, let's see. Dave or Kathy, anything? I'm trying to.
Yeah, I may have alluded to certain kinds of things. I can get winded.
Well, anything
Sorry.
else you can think of? I mean, if you had, really,
Oh,
not
oh,
if, you do have an opportunity to speak into a facility being developed. Is there
Yep.
something that you would want to say?
Don't get a stroke. I mentioned to
Or
David.
everybody can get a stroke. I mean, that's really
Yeah.
the flip side of it. You know, nobody's immune from stuff like this, but yeah.
Nobody expects the Spanish Inquisition. I told David I was interviewed once for a newspaper, and after this whole thing was over, the interviewer asked me, is there anything else you want to say about it? Stroke? And I said, yeah, don't have one.
That'd be great. It'd be great if nobody ever had one.
Okay, so what's the question
I don't know,
again?
did you have a question in that?
What would I want to say?
Well, just, is there anything else you can think of that if you were sitting down with someone developing a rehab center, what would you tell them? Was there anything, you did give us, I think, some really good things, but if there's anything else that comes to mind? Would you want to ask him just from, like, talk about what we documented in Jamaica and what you do down there and the potential benefits of intensive types of therapy over a week's period of time? I don't know.
Yeah, I
Just
think
thinking
Andrew's
out
gonna
loud.
be the one that's gonna talk the most about
Okay.
that, but, yeah, that would all be sort of speculative, I guess.
Okay.
Let's hold that a second, because I think Kathy did I got a couple more specific questions too, and
Yeah,
then we'll open it up big.
Right.
Kathy, go ahead.
I'll have to kind of come about this from a roundabout way. But obviously, when you first went to the hospital, there was a group of people, doctors, nurses, that were working with you. And then when you went to the next place, there's a new group of people. The next place, there's a new group of people. Talk about continuity of care and how you feel that if you were in one location from the time you were brought to the hospital to the time that you actually came home, how that might have been a help. I don't want to lead you in this question, but that's kind of what they're proposing, is that you're going to be working with the same people. You don't have to explain where you are with
Sure.
a whole new group of people. So
Yeah. Well, theoretically, wherever you go, your records follow you.
Oh, okay,
I haven't got to the thing.
okay.
I'm just doing this as an editorial comment. Theoretically, your records go where you go, and anyone who is involved with you is privy to those records. So there is a continuity of care. However, I personally feel that it is so important to have your therapist have absolute and complete knowledge of your records, that there are advantages of having care follow along a line from right after your stroke to when you're finally discharged, whether it's with whatever kind of therapy you are having.
That's good.
yeah.
That's all, folks?
You have, yeah, how are we doing?
No, no.
We're at 10 of 11. We have to be at Arcadia. I know you wanna do some B-roll.
Mm-hmm. When do we have to be there?
Well, at noon, probably. I mean,
Okay.
I can call Dana and we can catch her getting lunch in the cafeteria if we wanna do some B-roll.
Yeah, anything like that would be great.
Can I just, I wanna ask this though.
Sure.
So we're
You're
going
rolling.
and everything?
Let's go.
talk about, talk to physical therapist students. You were quite involved in the Arcadia program.
Yes.
Talk to students about the benefits of rehabilitation.
Rehabilitation and the benefits of it are: A, you can't get enough therapy. B, therapists don't understand how important they are to a patient and what kind of importance they leave long after they've gone. They realize, okay, I'm a therapist. Well, that's right, but they will mean so much to their patients. They don't even understand that until they get actually working. But they will be the most important factor for patients' recovery. I believe very strongly in this. Therapy students bring a level of enthusiasm, of intelligence, of life back into a stroke patient's life. And they will continue to do that. And long after a patient is used to or has finished with their therapist, both will realize they were important factors in each other's lives. They were crucial to their improvement. I personally know a person who she has very severe aphasia. She's had 9 speech therapists. She has a wonderful photograph where she's standing with all 9 of them, and the glow on the faces all through all 9 of them and the patient. Extraordinary, just extraordinary.
Are you still in touch with some of your therapists, even 9 years later?
I am not personally in touch with many of my therapists because I've done so much therapy and I continue to do therapy. Often the therapist is different from the ones before, although I would certainly like to have the same ones, and I often ask for the same ones. I just have an entire world of feeling towards therapists. I think they're the most wonderful creatures on the face of the earth.